An estimated 23% of deaths in the African region have been linked to the environment. According to the WHO, poor access to safe drinking water, inadequate sanitation, poor infrastructure, unplanned urbanization and pollution are some of the factors making the environment unsafe. These threats could escalate if the region does not develop a strategic action plan to check them, especially with the emergence of climate change. This is why African Ministers of Health and Environment recently convened in Libreville, Gabon, to brainstorm on how policies can be turned into beneficial action. The region intends to leverage on its partnership with the United Nations and the World Health Organization for solutions.
First of all, we've established within the United Nations a very strong partnership between WHO and the United Nations Environment Programme. And together we've managed to work at the country level with ministries and sectors of health and environment, have helped them to establish a common platform in some countries for joint analysis of risks, of vulnerabilities, and also development of joint plans.
If we're able to take care of diseases that are connected with the environment, the disease burden is reduced, health expenditure is reduced, and in fact most of the problems that the Ministry of Health takes care of will be reduced.
The third Interministerial Conference is also expected to help Africa build regional synergies to promote biodiversity in the region. But the major consensus among delegates is that Africa needs to fund health and environment initiatives.
One of the observations that we make is that the financing has not been available to the extent that it could have been to scale up some of these interventions that have been discovered. So one of our strong expectations now is that with this experience of 10 years, with the lessons that we've learned about what works, and with the opportunities offered by some of the financing mechanisms that have sprung up in the last few years, we can go much further.
We need to really turn the policies into action, concrete action through innovative solution. And this innovative solution is really the focus of the discussion at this conference.
This conference will galvanize more synergy between the Ministries of Health, Environment, Water Resources, in order to be able to tackle disease burden arising from environmental linkages, particularly waterborne diseases, vector-borne diseases, and the new problems arising from chemical pollution of soil, water, and air.
The 2018 event, jointly organized by the WHO and the UN Environment, comes 10 years after the endorsement of the Libreville Declaration. About 300 experts in health and environment and financial sectors from 54 countries were in attendance.